Hello, my name is Amanda Rindunastiti. I am from 07IGP002, and this time I would like to explain my mind mapping for the Introduction to Psycholinguistics course from Meeting 6, and the title is Language Disorder. First, we need to know what is language disorder. Language disorder is a communication disorder that can affect kids. Children with language disorder have trouble understanding and speaking language. They may struggle with written language, spoken language, or both. Kids with language disorder often use short or simple sentences, mix up the order of words, or say a lot. These challenges can cause problems at home, at school, and with other children. Language disorder is different from speech sound disorder. In speech sound disorder, the child has problem making sound. In language disorder, the child can make sound but has trouble using them to communicate. There are two types of language disorder. First is expressive language disorder. It refers to difficulty with expressing meaning or message to others. And the second is receptive language disorder. It refers to the difficulty processing and understanding meaning and message from others. This type of language disorder also have symptoms. They are for the expressive language disorder, like such as putting words in the wrong order and then repeating a question while thinking of an answer, and then they are confused with tenses. For example, they use past tense instead of present tense. And then they also have trouble learning new words and have a limited vocabulary for their age. And then for the receptive language disorder, the symptoms are they seem not interested in conversation or social situation. And then they also have difficulty following direction, often misunderstanding what is asked and answer inappropriately, and then having difficulty for getting jokes and having a hard time following direction or organizing thoughts. And then the next is language disorder classification by age. These are some signs of language disorder by age. For the first is 12 months. They using gesture such as pointing or waving bye-bye. And the second is for 18 months. They prefer gesture over vocalization to communicate. They also have trouble imitating sound and have trouble understanding simple verbal requests. And then by 2 years, they only can imitate speech or action. They don't produce words or phrase spontaneously, says only some sounds or words repeatedly, and can use oral language to communicate more than their immediate needs. They also can't follow simple direction, has an unusual tone or voice, such as raspy or nasal sounding. For the next slide, we have general classification of language disorder. The classification is divided by two. First is speech disorder. A speech disorder is a condition of which a person has problem creating or forming the speech sound needed to communicate with others. Speech is one of the main ways in which we communicate with those around us. It develops naturally, along with other signs of normal growth and development. Disorder of speech and language are common in preschool-age children. Disfluency are disorder in which a person repeats a sound, word, or phrase. Stuttering may be the most serious disfluency. It may be caused by, first, genetic abnormalities. The second is emotional stress. And the last is any trauma to brain or infection. The second type is communication disorder. Communication disorder is an impairment in the ability to receive, send, process, and comprehend concept or verbal, nonverbal, and graphic symbol system. A communication disorder may be evident in the process of hearing, language, or speech. A communication disorder may range in intensity from mild to profound. It may be developmental or acquired. Individual may be demonstrate one or any combination of communication disorder. A communication disorder may result in a primary disability or it may be secondary to other disabilities. And then the next slide is varieties of language disorder. First, we got sensory impairment. Sensory impairment is when one of our senses, such as sight, hearing, smell, touch, taste, and spatial awareness is no longer normal. For example, if you wear glasses, you have a sight impairment. If you find it hard to hear or have a hearing aid, then you have a hearing impairment. A person does not have a full loss of a sense to be sensory impairment. Mostly, sensory impairment is the combination of both hearing and sight impairment. It is not necessarily a total loss of both sense. Indeed, the majority of dual sensory impaired people do have some degree of sight or hearing. Those with a less serious degree of both sight and hearing impairment may also be referred to having a dual sensory impairment or loss. And then the second, we got apraxia. Apraxia is a motor disorder caused by damage to the brain which causes difficulty with motor planning to perform tasks or movement. The nature of the damage determines the disorder's intensity, and the absence of sensory loss or paralysis help to explain the level of difficulty. Children may be born with apraxia. Its cause is unknown, and the symptoms are usually noticed in the early stage of development. If apraxia occurring later in life, it is known as acquired apraxia. It is typically caused by traumatic brain injury, stroke, dementia, Alzheimer, brain tumor, or the other disorder. The next, we got dyslexia. Dyslexia is a learning disorder that involves difficulty reading due to problem identifying speech, sound, and learning how they relate to letters and words. It is also called reading disabilities. Dyslexia affects area of the brain that process language. People with dyslexia have normal intelligence and usually have normal vision. But mostly children with dyslexia can succeed in school with tutoring or a specialized education program, and emotional support also play an important role. The next, we've got dysgraphia. Dysgraphia is a neurological disorder of written expression that impairs writing ability and fine motor skill. It is a learning disability that affects children and adults and interferes with practically all aspects of the writing process, including spelling, legibility, word spacing and sizing, and expression. And then the next is stuttering. Stuttering is a speech disorder characterized by repetition of sounds, syllables, or words. An individual who stutters exactly knows what they would like to say but has trouble in producing a normal flow of speech. This speech disruption may be accompanied by struggle behavior, such as rapid eye blinks, or tremors of the lips. The next is Down syndrome. Down syndrome is a genetic disorder caused by cell division produce additional genetic material from 21 chromosomes. Down syndrome causes a characteristic facial appearance, intellectual disabilities, developmental delays, and can be associated with thyroid or heart disease. The next is autism. Autism is a neurodevelopmental disorder characterized by difficulty with social interaction and communication, and by restricted and repetitive behavior. And the last we got ADHD. ADHD is a common behavioral disorder that affects an estimated 8% to 10% of school-age children. Boys are about 3 times more likely than girls to be diagnosed with it, though it is not yet understood why. Okay, that's all from me. I hope the explanation is helpful. Thank you so much for watching and goodbye.